Well, thanks for joining us in Focus on Africa from BBC World News. We start in Kenya, where children and parents are waiting for schools to reopen on Monday. They were shut in March during the third wave of COVID infections. The move was to help stop the spread of the virus. Now, the reopening of schools is happening despite concerns about the India variant, which was found in the country a few days ago. Now, one of the directives for reopening was that all teachers should be vaccinated by the time school restarts. So, has this been achieved? Well, as of today, just over 911,000 people out of a population of over 50 million have been vaccinated. Authorities say just below 143,000 of them are teachers. The total number of teachers deployed or employed by the government is likely to be double that amount, which is about 300,000. And with many employed by private schools, that number could be higher. Now, adding to the problem is the vaccine take-up in rural areas where the nearest vaccine center can be hundreds of kilometers away. Now, Mercy Juma reports from Baringo County, where just 20% of teachers have received the jab so far as the country prepares to reopen schools.
On a rugged road, right in the middle of long stretches of sparsely populated land, is Tibingar Primary School in Kenya's Rift Valley. Empty for now, but in a few days' time, the pupils will be back from their 10-week holiday to start the new school term. For teachers here, getting vaccinated is a challenge that city dwellers don't have to face.
I have to foot almost 1 kilometer to reach the main road. And then from there, I pick a public vehicle or maybe a motorbike all the way to Marikat, which is 20 kilometers from my school. And then from there, I may wait for another public vehicle to be filled to go all the way to Kabarnet, which is roughly 40 kilometers.
The terrain on the road to the vaccination center is unforgiving. Public transport unreliable, and at times poor weather makes access to the health facilities almost impossible. It would cost the teachers, they say, almost $10 to get to a vaccination site where the free Covid19 jabs are being offered. There are about 700,000 people here in Baringo County, and this is one of the 6 vaccination sites across the region. According to county records, about 6,000 people have received the jab so far. That number includes just 20% of all the teachers in the county.
Sometimes people stay at home when they're sick because of those competing interests. Are you buying food with the small money you have, or are you going to hospital? Where is the fare, transport, and so forth? There needs to be made arrangements to take the vaccine to the people, as opposed to sitting here and waiting for people to come from those far areas.
Aside from the access issues, adherence to COVID-19 containment measures is low. At the shopping centers, people walk around without face masks, and there's little social distancing. Back at the school, the teachers and their community face another challenge: myths and misconceptions about the vaccine.
We fear getting this vaccination, and the fear arose through the information we get from media that in other areas, people have been vaccinated. Some have blood clotting, some the hand which is injected is paralyzed.
With little access to the internet and TV, the public health message about the safety of the vaccine is not making an impact. Statistics show that children are less likely to get severely sick if they get the virus, but the risk is far higher for the teachers and support staff in schools. Mercy Juma, BBC News, Baringo County.